Have you ever had pain in your lower back, but then after a little while your hips start to hurt, or maybe you even get pain into your legs too? It can feel like a never-ending cycle, and it's frustrating when you're not sure what's actually causing it. You're not alone. The lower back, the pelvis, and the hips are deeply connected, and a dysfunction in one area can easily affect the other. Plus, pain can be referred from one area to another. So you might think that it's your hip, but it could actually be something different. Hi, I'm Alexis Wadeland, osteopath and co-founder of Blossoming Me and Healthy Learning Lounge. Today I'm going to simplify this hip, pelvis and lower back connection, why these areas work together and how pain moves between them, and what that means for your recovery. In the next few weeks, we'll build on this and provide a few tips to identify where your pain is coming from and some things that you can do at home to help you feel better. So why are these three areas so connected? Let's start with the basics. Why do the lower back, pelvis and hips affect each other so much? Well, your lower back, lumbar spine, transmits movement from your upper body and absorbs pressure that comes from below as you move. Your pelvis is a foundation of stability and to allow movement. It acts as a bridge between your spine and the legs, playing a crucial role in balance, stability, and mobility. Your hips allow the movement that is generated via the muscles and connects directly into your pelvis, influencing position and function of the pelvis and the back. When just one of these areas is out of alignment or not moving properly, the others need to compensate, which often leads to more pain and more dysfunction. Try to imagine a tripod. You've got three legs, and if one is uneven, then the whole thing will begin to wobble. And your back, pelvis and hips work in a sort of similar way. If one is off, the other two have to feel the strain. This is why back pain doesn't always mean that there is actually something wrong with your spine. It could be compensating for strain, instability or dysfunction in your hips or your pelvis. While your back may now also need treatment, without dealing with the other issues found in the hips and or pelvis, your back pain won't fully resolve. Not only this, but there's also many nerves, ligaments and tendons in that area that can create pain. And it can feel like pain is coming from two places at once. Or the tissue itself may refer pain to another area. Or the nerve may become irritated and send pain signals in areas that don't feel connected. So why pain can feel misleading? Here's the tricky part. Pain isn't always where the problem actually is. For example, if you have tight hip flexors, the pelvis might tilt forward, which increases the strain on your lower back and your hamstrings. You may only notice this strain in your lower back, not as buttock tension or pain through the front of the hips. Or if your pelvis is unstable, it could cause sacroiliac joint dysfunction, which might send pain down into your hips, your buttocks, and even into your legs. And you may feel sure that it's your hip that needs replacing, but it's just the sacroiliac joint that is dysfunctional, causing increased muscle activation of that whole area and irritating your nerves, causing pain into your thighs and legs. So, have you ever felt pain in your lower back only to have it disappear and seem to show up for no reason in your hips later? Drop a yes into the comments if this has happened to you. So, what can you do about it? That's exactly what I'll be covering over the next few videos. So next week, I'll discuss how to tell whether your pain is coming from your back, hips or pelvis, or maybe some combination. In week 3, I'll discuss the signs and symptoms of dysfunction and what they might mean. And in week 4, I'll bring some stretches and exercises for you to help you to restore balance and to reduce your pain. The aim is to provide you with clarity about the causes of your pain so that you can find appropriate treatment options and use a few exercises at home to help you to rebalance your body, improve your function, and reduce your pain. So if you're tired of feeling stuck and want real solutions, make sure to watch the next videos. Hey, if this resonated with you, please remember to click like and let me know in the comments, where do you feel the most pain? Your back, your hips, your pelvis, maybe all three. And don't forget to subscribe or follow so that you don't miss the next video. So that's all for today. In health, bye for now.